Welcome. Many people have asked me how I started Bioconcepts and why I started Bioconcepts. It happened back in 1984. I was in actual practice, and I actually found that many of the nutrients and tools of the trade in naturopath was very lacking, and I wanted to do something about it. And seeing a lot of interesting patients that who have gone to many doctors and had no success, I needed a whole number of nutrients to actually help these patients. So I started to design products, and I actually came up with the word Bioconcepts because I felt that part of the whole Bioconcept ethic is education. It's biology with conceptual education. And many other webinars and seminars that we've actually even today continue in trying to train naturopaths the conceptual approach rather than a protocol approach that many companies actually use. So what we want to do is have a conceptual understanding, an educational understanding of the use of the product, and making sure that the product that you are actually using with the patient is the purest, the best, and the most effective with therapeutic range of nutrients. There's no point having a nutrient in your product but it's not in therapeutic range. Through the development, and as we saw patients responding to our product line and things of that nature, and through our education in particular, because it's no point having a product and saying it's good, but you don't educate the actual naturopath or a therapist to actually understand why it actually works. So what we try to do is to, in our education, have a conceptual education. So once you got the concept of a particular illness or something like that, you can actually virtually treat any person with the nutrient combinations that we actually have. So the Bioconcepts then developed over years, and then I found back in the 80s, about the 90s, I realized that there were gaps in our nutritional armamentarium, and I started to introduce new product lines that had never been seen in Australia, like coenzyme Q10, lipoic acid, glucosamine, carnitine, acetyl L-carnitine, 5-hydroxytryptophan, nutrients of that nature, which actually added to the armamentarium, and particularly in areas of energy and mental health. And we've been leaders in education and in Australia for the last 30 years. Through my books that I've published, you know, like the latest one, the Nutrient Bible, I think it's the 9th or 10th edition, which has doubled in size because the armamentarium has increased and you have to know the knowledge base behind the nutrients. The sleep book, which talks about the new concepts of sleep and how to regulate sleep. My cancer book, Nutrition and Cancer, which basically deals with cancer in a preventive strategy way, and also supporting the oncologist with his treatment so there's better treatment with less side effects. Actually, when I first started Bioconcepts and was trying to work out what are the product lines that we should actually work on, I concentrated on two areas basically. It was inflammation and antioxidant defense systems and detoxification, and the other section was on mental health. I was very attuned that there was very little being done in mental health and I came up with nutrients and precursors of neurotransmitters, and I was one of the first in Australia to introduce this concept of using amino acids for mental health, you know, as precursors for dopamine or serotonin or GABA or opiates and things of that nature. And I also was, because I became very interested in genetic defects in children, I started basically doing a lot of work with Down syndrome, so I started coming out with products for Down syndrome and children. So that's what I did over the initial periods. As time goes on, in the 1990s, I introduced a new range, the Dr. Vera range. The reason that I wanted to do that is I wanted to get rid of a lot of excipients. When you make a tablet, there's 4 or 5 excipients in there, and although they say they're safe, I just wanted to limit the amount of exposure to that and just have the pure nutrient with the most limiting amount of excipients as possible. And that's where we came up with the Dr. Vera range. It was a pure range. It didn't have magnesium stearates in it. It didn't have the binders and things of that nature. We used vegetable capsules rather than the usual animal capsules that people use. And basically that was our newer range, and I used the concept of mitochondrial energy support in this range. I came up with a lot of nutrients that were totally orientated to the mitochondrial support, and that was very good. But what we noticed is that although we were a practitioner-only range, many people you could buy the product on the actual net, which we didn't allow, but we couldn't stop. So we've come up with the white label, where we actually sign a contract with the individual naturopath or clinician, and saying these products are only to be used in a clinical practice, because that's how we've designed the actual usage of these products. So what we try to do is to bring out a range of products that were synergistic, they work together, and basically were specific for different types of illnesses. And over the period of time, I was able to develop many product lines using that model. So all those things are considered in BioConcepts, and I'm hoping that you will actually follow our programs, our education, and become great supporters of ours.